This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. This morning, our guest is Dr. Ihtishaam Qazi, oncologist, Mon Health Cancer Center, and we're going to be talking about breast cancer. Of course, October is Breast Cancer Awareness Month. Let's bring in Dr. Qazi. Good morning, sir.
Good morning. Thank you very much for having me.
Well, thanks for taking a few minutes. Just combined the word moments and minutes and came up with a new word there. Thanks for taking a few minutes with us. We'll get into the subject of the day. You've been on with us a few times, but just to remind folks about your background, education, training, the whole nine yards.
Sure. So I was born in the great state of West Virginia. I was born in Charleston, West Virginia at CAMC. Lived most of my life there in Cross Lanes. I graduated from Nitro High School, so go Wildcats. After that, I went to college at Case Western Reserve University in Cleveland, Ohio. I started my kind of fascination with cancer, did cancer research there for many years while I was getting my undergraduate degrees in biology and nutrition. And then I came back to West Virginia. I couldn't stay away. So came back to West Virginia, came back to Morgantown actually in about 2000. And I did all my medical training here and, worked as a hospitalist. And then about more than 3 years ago, I joined Mon General.
And what drew you to oncology?
Well, when I was, this is now going on like 25 years, I actually started doing research on, cancer cells. And it was fascinating. It was a fascinating field to be in at that time. And there's been a lot of changes in cancer since then. It's just, it's been both the science and the satisfaction of trying to help people out at kind of the hardest time in their lives. It really drew to me. It really called to me, and I really do enjoy trying to give people at least as much hope or compassion as I can during, like one of the most difficult times in their life.
Yeah, the word cancer probably scares more patients than any other word. So when you have to treat patients or lay out a plan of treatment for patients, how do you even begin to approach that? It would seem it's probably the worst day in their lives, and it's got to be difficult for you as well.
Yeah, I think, one of the things that physicians sometimes don't do a great job is trying to explain to people a little bit about the cancer, because cancer, like it is, even to sometimes other physicians, it's a black box. It really is it's a hard thing to understand. And I have found with patients, if you can help, like kind of really, put it in their terms and have them understand what we're actually doing and trying to really work through the reasons and the whys and, why we do what we do. I think they follow it much better. They do a much better job getting through the treatments if they know exactly why they're doing, X, Y, and Z. And, they're putting their bodies through, tremendous amount of treatment and just a lot of medical care. And so usually it comes down to really talking to the patient, spending that time with them, making them understand. And I tell my patients it took me years to understand this stuff. I don't expect them to learn it all in an hour session with me. But the most important thing is that they keep on asking our questions. They keep being informed and make they have to have participation in their care. And that usually, I think, gets us to the best therapeutic relationship.
I mentioned at the top of the show, October is Breast Cancer Awareness Month. The statistics when it comes to breast cancer, they're surprising. I know it's common, but I was surprised at just how common and how many people that particular type of cancer touches.
Yeah, it is like one of the most common cancers that we obviously encounter. 1 in 8 U.S. women are predicted to develop an invasive breast cancer over the course of their lifetime. The last figure we have in 2022, there's estimated 287,000 plus new cases are expected to be diagnosed. That's not even including, I think, the 50,000 precancerous conditions of DCIS. We expect about 43,000, a little more than 43,000 breast cancer deaths. The incidence of breast cancer is also increasing slightly since about 2005. We think that a couple of risk factors are increasing the population. So there's a little bit of an increase in the incidence. But I think the one good thing is our treatments and detection, all that have come really well into play. And so now really we're, just trying to make sure we get women to proper screening and to get them to the best results possible.
We'll talk more about that when we come back from this break. We'll talk about detections and screenings and what are the next steps after that. Plus, there's actually a Facebook Live event coming up to tell you about as well. Dr. Qazi, oncologist, Mon Health Cancer Center, our guest this morning. And we'll continue the conversation in a moment as Mon Health Talk continues on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Qazi, Mon Health Cancer Center oncologist. And, of course, October is Breast Cancer Awareness Month. And, Dr. Qazi, what are the different types of mammograms that are available at the Mon Health Cancer Center?
Okay, so, obviously the best way to treat breast cancer is to detect it as early as possible. And the most effective tool we have for that is a mammogram. Obviously, we still like to have our patients do their self-breast exams and clinical breast exams when they see their healthcare providers. But no doubt the mammogram, using low-dose X-rays has been shown to significantly reduce the number of women age 40 above who die from breast cancer. It's been just, the wonderful development in modern healthcare. The old school type of mammogram, just was simple like X-rays. The newer type, and what we offer here at Mon, is what's called digital breast tomosynthesis, or 3D mammography, is what you see advertised on the billboards. And basically, it allows the technician to basically reconstruct the breast into like 3D images, which obviously will aid the radiologist in being able to read a scan and be able to be more accurate in detecting any abnormal tissue.
Talking to Dr. Qazi, oncologist, Mon Health Cancer Center. In addition to the mammograms, are there other screenings available that help detect breast cancer, whether it's early stage or late stages, whatever? Yeah,
so actually it's a good, we use our mammograms as our starting tool, and then, many times, even people with, if they have some abnormal issue on their mammogram, they'll be escalated to do a breast ultrasound, and sometimes, there are certain characteristics of a certain woman's breast. If they're a little bit more dense, sometimes we'll use ultrasound as well, using, just sound waves to examine the breast tissue. Sometimes they also use that just as in a diagnostic sense. Like if there's something abnormal in the mammogram, the ultrasound becomes your next step to see exactly what that issue is. Sometimes we even use breast MRI to help really be able to see really in depth into a woman's breast if there's a tissue before we would decide to go do a biopsy. So, usually we have several different modalities to kind of look at anything abnormal on the mammogram before we decide to actually get a biopsy.
What should women look for while doing a self-examination?
So really the thing is that, really we encourage women to kind of at least, once a month, and they, try to be use a similar time a month, especially for people who are still having they haven't gone through menopause yet, they're still cycling, because the different times of month of estrogen can affect the breast. But, usually you want to check your breasts for anything that feels unusual. You should look for any kind of breast lumps, changes in size. You should always make sure there's no fluid or anything leaking from the nipples, and especially any irregular thickening of the the skin or the underlying tissue, that should be brought to a healthcare provider's attention as soon as possible.
Are there other symptoms or signs that might tip you off that something's amiss here?
Well, I mean, other than just finding something on the breast itself, I mean, some women, they're very sensitive to changes in their body, and so I really recommend there are really big red flags like unintentional weight loss or fatigue that is new and obviously not out of proportion to what they're used to, or muscle weakness. But if anything, really feels off, and if someone's really doing their exams, I really recommend them to go see their family care doctor and at least start trying to find out what that is.
Oncologist Dr. Qazi joining us this morning from Mon Health Cancer Center. We'll continue our conversation. We'll get into some risk factors when it comes to breast cancer in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Oncologist Dr. Qazi joining us, Mon Health Cancer Center. Got a text into the show this morning, Dr. Qazi, and I want to get into breast cancer risk factors, but the listener wants to know, can a lump inside of your armpits indicate a type of cancer?
And so actually, there's a really good question. Actually, yeah, I can. Several times, actually, sometimes we've actually diagnosed breast cancer as it being a lump in the armpit, or axilla, the medical term for it. But that's definitely can be an indication of cancer. It also could be a sign of infection. Obviously, a lot of people who got their COVID vaccines also experienced lumps in their armpits from after the vaccine. So it can be obviously a variety of different things. Cancer being one of the things that's differential. Again, something that should be looked at by a healthcare provider.
What are some risk factors that have been discovered that factor into breast cancer?
Sure. So I think one of the most the more well-known risk factors, kind of the genetic risk factors that are talked about a lot. Those really account for true genetic disorders that we know of that run in families. Account for about 5 to 10% of breast cancer cases we see today. And the more famous of those are the BRCA mutations, BRCA1, BRCA2. And that could be like a sign that if in the family, if people have had either breast cancer, ovarian cancer, prostate, pancreatic cancer, these are the kind of cancers that cluster with BRCA. And so if you've had a family history of these cancers, then especially in a close relative, you should really see a healthcare provider and get appropriate screening early on, for that. We know so that we say 5-10% for that, but we know that family history, there's a lot of stuff that we don't know, and we know that if there is a first-degree or second-degree relative with breast cancer in your family, then your chances of breast cancer goes up. So family history is very important. But at the same time, I always tell my patients about, almost half of the patients we see, they don't have anyone in their family who has breast cancer. So we had to look at the other risk factors associated with that. And that's kind of a complex, issue with how much hormone exposure they've had in their life. When did they have children? And we know breastfeeding is a protective risk factor against breast cancer. There's women who used hormone replacement therapy after menopause that are higher risk. There's a little bit of a risk that comes with oral contraceptive pills, much safer now than they were before, but there's always a little bit of added risk there. There's we know smoking and alcohol can also increase our risk, but the biggest kind of overall theme there is that there's a idea of estrogen exposure, and so therefore the healthcare provider will kind of establish that risk factor from that. So.
Got just a couple of minutes left. Tell me about the Facebook Live events you have coming up next week.
So on I think that's the 12th. We actually have Facebook Live event with both our radiation oncologist therapist and one of our infusion nurses, Tina Embacher. And we're going to be doing a Facebook Live event where people can submit questions to us live about, anything about breast cancer. We have from the avenues of the treatment from the radiation oncology side, and Tina Embacher is both a survivor and a infusion nurse who gives chemotherapy for breast cancer. We have a lot of different, kind of viewpoints to help people, talk about and answer the questions about breast cancer.
That'll come up Wednesday, October 12th. That's a week from this Wednesday. It's from 6:30 to 7 o'clock. You can visit the Mon Health System Facebook page to participate. Where can patients get their annual mammograms with Mon Health to obviously help prevent breast cancer, because the best way to treat it is to prevent it or detect it very early?
That's right. So we offer 3D mammograms here at the health center in Morgantown, in our Fairmont and Grafton and Weston and Kingwood locations. So they can, if anyone wants to learn more or even schedule, they can go to monhealth.com/mammogram to schedule an appointment.
What's the one takeaway? If folks are only going to take 1 point away from our conversation today, what do you want them to leave with?
I think that for all our mothers, sisters, daughters, wives, everyone out there, take care of yourself. This is a disease that can be easily treated and is detected early. So I encourage all the husbands and wives and sons and daughters and everyone who has that, their special ladies in their life to really, make sure that they take time out to get their screening mammograms done. Because definitely early screening and prevention is the way to early detection is the best way to cure cancer.
And from our conversation there about risk factors, unlike maybe some other cancers where you go, well, there's a direct correlation because of smoking, because of this risk factor, that risk factor, seems pretty non-discriminatory. It can pop up with anyone, anytime. So detection seems to be the key.
That's exactly right. 100%.
You can always get more information. Go to monhealth.com/mammogram or monhealth.com/cancer for more information. Dr. Qazi, always enjoy visiting with you. Stop by anytime. You're always welcome.
Thank you so much. Appreciate it. Enjoyed it.
Absolutely. Dr. Qazi, oncologist, Mon Health Cancer Center. Again, you can get more information over at monhealth.com/mammogram or monhealth.com/cancer. Don't forget, next Wednesday, the Facebook Live event. For details, you can visit the Mon Health System Facebook page and get more information there. That'll be, again, Wednesday, 6:30 to 7.